Hi, Anna. I want to give you some feedback about the interview that we had as we do the evaluation. How did you think everything went?
I think it went pretty well. I was able to screen for drugs, alcohol, and some of the risk behaviors. I feel like she was able to be pretty open with me about what was going on, and I just tried to be encouraging about making good decisions.
Well, I do think you have a really nice style of interacting with her, and she was pretty open with you. I was really pleased about that. I think in terms of the screening, one of the things I would encourage you to do is to kind of do more extensive screening. So really check about other drugs like prescription drugs, which weren't covered, I think. When you do the craft, you ask the first question, but you didn't actually kind of get some of the other questions. So usually when they're screened positive on that first question, you want to ask a couple of more of the questions so that you could score it.
Okay.
So does that make sense? But you asked about all three. I think that went very well. You kind of got good information about her drinking, about when she was drinking and doing those kind of things. So I think that went pretty well.
Okay.
In terms of the brief intervention, how do you think that went?
You know, I tried to sort of use a summary of what she told me to then move into affirming that she was making some good decisions, and then just to try to let her know with the alcohol that it was sort of risky, so give her that feedback.
Right.
So I think I focused a lot on that. I think it went okay in the time that I had.
Yeah, I think that's always true. There's a short period of time. And I thought you did a nice job. The affirmation was really good about kind of affirming what she was doing right. And that's always, I think, important and engaging. You could see she kind of perked up a little bit when you were kind of giving her a compliment.
Well, I do think you gave her a lot of good feedback. You brought some things in. The only concern I had was that she wasn't really engaged with you in a lot of that. So usually when you try to give some of the feedback, you also ask what she thinks about that, or you get her to buy in a little bit and you check. So I think that was something that you could probably do a little bit more of as you kind of get more comfortable with this. The information's good, but a lot of times the information doesn't take hold, or she doesn't really process it unless you get her to kind of think about it a little bit.
Talk about it.
Yeah, and talk about it a little bit more. So I thought you did really a nice job there. The other thing that didn't happen was that you didn't check in terms of how ready she was to do some of those things. I thought she agreed with you, but I mean, were you convinced she was going to go do all of these things afterwards?
I guess looking back, she sort of said okay a lot.
Yes.
But if you asked her, well, do you think you could do this? Because you advised her not to drink at all. And she was drinking to kind of fit in. So maybe, you could have asked, is there some other things you could do? How could you kind of handle yourself without drinking at a party, and getting her to give you a suggestion?
Yeah,
That might have helped kind of get her to buy in.
So that was pretty good. I really liked the affirmation. So I thought you did a really nice job with the affirmation, that she was doing good. And you could see she felt better about that too. That was kind of nice. And again, with goals, usually try to negotiate a goal with them. You kind of set out the goal. You shouldn't drink. You shouldn't drive with this person anytime, even with any kind of. But it would be better if she kind of could say, well, no. And she did kind of negotiate a little bit. She said, I'll call my parents the next time, which was really good. But if you can kind of get her to kind of generate some of the ideas like that, that was more a reaction to what you said rather than a negotiation with her about what you said.
Yeah, I didn't ask her that.
You didn't ask for that kind of information.
Yeah.
So that was another issue that, again, we're trying to kind of make this a little bit better. And again, confidence is another thing. So you can ask about readiness, you can ask about their confidence to do something, so that was another issue. But you did you asked some open-ended questions. She really talked to you about some of the things she was doing. You did a nice affirmation. You did reflect on how she was using the alcohol, and you gave her at least a reflection there. And you tried to kind of summarize the issue. So I thought you did a really nice job overall. It's just, I think, a little more paying attention to her, engaging her, getting her involved, and negotiating with her would be helpful.
Okay.
Good. Do you think that could be done, or do you have any questions?
I feel pretty good about moving forward and trying to do those particular things to help engage with the patient more.
Good. That sounds wonderful.
Thank you.
Good.